everyone. Welcome back to another episode of Ascend TV. My name is Dr. Cadet, and we help self-insured employers lower their workers' compensation costs. Today, we're going over a case of a gentleman who had abdominal pain after lifting and carrying cases of water throughout his work site. As he was doing this, his foot slipped and he felt a pull in his abdomen and his left groin. Evaluation by a medical provider went on to discover that he had developed an umbilical hernia, and he was referred to general surgery where his 1 centimeter umbilical hernia was repaired. 1 centimeter, ladies and gentlemen, is very, very tiny. And we all know workers' compensation is not very efficient. So it is a tragedy that it took 3 months for him to get his umbilical hernia repair. But nonetheless, he got it. And we would expect that about 5 to 6 weeks after having his tiny hernia repaired, he would be able to return back to his job at full duty. The projected costs for this claim were estimated to be roughly $3,000. Do you all think he was able to get back to work within the 5 weeks? The answer is no. Took 5 months for him to return back to work, costing the employer $19,000, in addition to them setting aside $31,000 worth of reserves. Ladies and gentlemen, that's $50,000 for a 1 centimeter umbilical hernia repair. So Ascend came in, we reviewed the records, and we saw that the general surgeon had actually cleared the worker to go back to full duty approximately 6 weeks after the surgery, but the primary treating provider opted to continue the worker on restrictions and off of work. So after working with the treatment team, we were able to get this claim closed within 3 months, saving the employer $15,000. Now they no longer need the reserves of $31,000, which means we save the employer over $45,000. And a lot of times, the primary treating providers don't mean any harm, right? But it can be difficult if a patient is coming into you and saying that they still have pain and doc, can you just give me a couple more weeks off? And you can see how that can snowball if we're not able to be a little bit more firm in our discussions with the patients on why their bodies have healed, why mild pain does not mean you can't go back to full duty, and how we can encourage and empower the patients to go back to full duty without running up the cost of the claim, right? So if you had 10 umbilical hernia repairs or 10 cases like this where they weren't returned back to work within 6 weeks, that would easily cost your organization nearly $200,000. And if you did that every month for the year, you're looking at a bill of $2.3 million. So how much is it worth to get additional provider training for your team, right? How do we talk to patients? How do we say no? How do we explain our rationale? How do we get them on board with the treatment plan? How do we get them on board with the timeline of recovery? How much is it worth to have tighter case oversight, to have someone come and look and say, oh, wait a minute, the surgeon has cleared him. He can go back to work, and coach you on, hey, you can still tell the patient, yeah, I know it's a little uncomfortable, but it's time to go back to work. And the sooner you go back to your regular life, the sooner you'll feel better, right? I'd say it's easily worth $2.3 million. So if your organization is having difficulty closing your claims for the reasons listed in this video, check out the show notes. Ascend has some resources that can help. Until next time, bye.